we'll move to another topic of hepatitis. Very interesting and important topic for your MCQ. So you have hepatitis A virus, B virus, hepatitis C virus, D and E virus. So what are the common name of these hepatitis virus? Hepatitis A is called infectious hepatitis. B is called serum hepatitis. C is called non-A, non-B transfusion transmitted hepatitis. D is called delta agent and E is non-A, non-B enteric transmitted hepatitis. Okay. Hepatitis A virus belong to family enterovirus 72, which is Picornaviridae. Okay. Hepatitis B belongs to family Hepadnaviridae. Hepatitis C is from Flaviviridae, D is not classified, unclassified type, and E is Calciviridae family. A and E is non-enveloped. Rest your hepatitis B and C and D are enveloped viruses. If you check their genome, all of them are single-stranded RNA virus except hepatitis B, which is double-stranded DNA virus that you have to remember. Onset of infection, abrupt will be hepatitis A, rest of all will have insidious onset. The age group affected in A is children and young adult. Hepatitis B can happen in young adult or toddler. Hepatitis C can happen at any age, D can happen at any age. E also you see in young adult. The route of transmission of hepatitis A virus is fecal-oral transmission. B is percutaneous, sexual mode of transmission and vertical transmission. Hepatitis C will also have, like hepatitis B, percutaneous, sexual mode of transmission and vertical transmission. D also same. Hepatitis A and E will have fecal-oral transmission. So, route of transmission when you check, hepatitis A and E has fecal-oral transmission, whereas B, C, D will have percutaneous, sexual and vertical mode of transmission. Carrier stage you won't be getting in hepatitis A and E. So, A and E will be carrier negative. If you check for hepatitis B and C, there are chances of carrier. Okay, D might have, might not have. See the percentage of carrier state. So, hepatitis A have 0.1 to 30% carrier state. C will have 1.5 to 3.5% chances of going to carrier state. Oncogenicity. So, oncogenicity is a feature of your hepatitis B and C virus. Okay. So, oncogenic hepatitis virus, your B and C. Incubation period, if you check for hepatitis virus, so incubation period of hepatitis A virus is 15 to 50 days. Similar you will have in hepatitis E virus. So, most of the feature you saw, hepatitis A and E had a similar feature, even incubation period is same. If you see for hepatitis B and D, both will have 50 to 150 days as the incubation period. Hepatitis C will have 15 to 150 days as a incubation period. Fulminancy, so fulminant rate, if you say fulminancy will be highest in hepatitis D virus. Fulminancy in pregnancy where it rises, so it is hepatitis E virus. So, you have to see the question if they are asking which hepatitis virus goes for fulminancy, the highest rate of fulminancy in which hepatitis virus you see. So, answer should be hepatitis D virus. If they are asking the question on fulminancy increases in pregnancy, then answer is your hepatitis E virus. So, fulminancy chances in pregnancy goes from 1 to 2% up to 20%. Chronicity is a feature of your hepatitis B and hepatitis C. Hepatitis B have 1 to 10% chances, where hepatitis C chances is more than 80%, 85% is. So these are the different features of your hepatitis viruses that you have to keep in mind, because this table will help you in solving MCQ. So try to remember this table. Now moving to hepatitis A virus. This is a vaccine preventable hepatitis disease. It is caused by single-stranded RNA virus, non-enveloped, and can lead to fulminant hepatitis. No chronic, no carrier stays in this. Children are more affected and they excrete the virus in the feces for longer time but are subclinical. Okay. Adult will show the icteric symptom will be more prominent in adults, and period of infectivity is 2 weeks before to 1 week after appearance of jaundice. So this is only hepatitis virus which can be cultivated, and blood will be better sample for IgM antibody detection. You can also detect from stool sample also. So there are few points which is unique about hepatitis A virus, that it is a vaccine preventable hepatitis disease. And there is no carrier, no chronic stage, right? And this is the hepatitis virus which can be cultivated. And period of infectivity of this virus will be 2 weeks before to 1 week after the appearance of jaundice. This is the picture of hepatitis virus, their morphology. So they have, you can see, DNA virus. They are incomplete double-stranded DNA virus, you can say. And these are different antigen. They have hepatitis B surface antigen. They have nucleocapsid antigen, which we say HBC antigen. They have DNA polymerase, which is RNA dependent DNA polymerase. Then envelope is there. So we have envelope antigen. So these are different antigenic structure present in hepatitis B virus. You have to remember they are DNA virus and their DNA polymerase is RNA dependent DNA polymerase. And these are 3 forms which we get for hepatitis B virus. So you have Dane particle, this is the Dane particle, okay, and you have filamentous form and spherical particle. So the most common form is your spherical particle and complete form is your Dane particle. Different kind of antigen you have. So hepatitis B surface antigen, which is pre-S1 and pre-S2, and hepatitis B surface antigen is also called as Australian antigen. Hepatitis B envelope antigen, which is pre-C region, hepatitis B core antigen, which is C region, polymerase P gene, which is the largest gene, X gene, which is responsible for carcinogenicity in hepatitis virus. So you can see this is the picture, PS1, PS2 and S, okay. Then you have DNA polymerase and other thing which we discussed now. So we'll see the feature of different antigen which is present in hepatitis B virus. So you have surface antigen, which we say hepatitis B surface antigen. Core antigen you have HBC antigen. Then pre-core antigen, which is also called as hepatitis B envelope antigen. So this hepatitis B surface antigen is Australian antigen. We saw just now. It is also called as Australian antigen. And it has a common group antigen A and 2 pair of type specific antigen like DY, WR is there and leads to 4 subtypes, that is the combination of this. So ADW, AYW, ADR, AYR, these are 4 subtypes which forms by combination of common group antigen and type specific antigen. ADR is prevalent in southern and eastern part of India, where AYW is prevalent in northern and western part of India. Hepatitis B core antigen forms in intracellular core protein and it is never gets secreted in the circulation. So, you can never detect hepatitis B core antigen. If you see hepatitis B pre-core antigen, which is envelope antigen, which is non-particulate soluble antigen and it gets secreted. Surface antigen will be the first antigen to appear. How many days after the infection? You have to keep in mind 8 to 12 weeks after the infection, hepatitis B surface antigen appears. And it indicates the onset of infectivity and transmission. Hepatitis B pre-core antigen, which we say envelope antigen, and DNA, hepatitis B DNA, these are marker which appears almost concurrently or shortly after hepatitis B surface antigen appearance. And they are marker for active viral replication and high viral infectivity. Hepatitis B core antigen, these are hidden antigen and due to its surrounding hepatitis surface antigen, you can never get them in circulation, you can never detect. Anti-HBC antigen IgM antibody, if you see, this is the first antibody to appear 1 to 2 weeks after hepatitis B surface antigen appearance. And this will be indicator of acute hepatitis B infection. If you see anti-hepatitis, anti-HBC antigen, which type? IgG type, that which show that is chronic stage. Okay. So, in chronic stage, your surface antigen will be there, person will be symptomatic and liver enzyme will be elevated. Okay. Carrier stage, if it shows, in carrier stage, your hepatitis B surface antigen will be there and person will be asymptomatic. If it is recovery stage, then you will have along with that anti-hepatitis B surface antibody. So, we will see in a tabular form. Before that, we will go through anti-HBE, that is hepatitis B pre-core antibody, which once it form, it will show that there is diminished viral replication and decreased infectivity. Anti-HBS, that is hepatitis B surface antibody, it appears after clearance of hepatitis B surface antigen and will remain elevated. It will indicate whether patient is recovered or immune, non-infected or vaccinated. This table will help you in solving different questions. So, how we interpret different conditions, like if it is early acute hepatitis, what you expect to be positive. So, hepatitis B surface antigen will be positive here and DNA will be present. If you see acute hepatitis B is there and having high infectivity, so surface antigen is going to be there and you will have antibody also IgM type anti-HBC. Envelope antigen will be there and symptoms will be present, liver enzyme will be elevated and DNA will be there. So, that you see in early acute hepatitis B with high infectivity. If you see the chronic hepatitis B with high infectivity, so you have surface antigen, right? And you will have antibody IgG type in chronic hepatitis B. Envelope antigen, because it is high infectivity showing, so you have envelope antigen positive over here and symptoms will be present, liver enzyme will be elevated, DNA you can see. If it is chronic hepatitis B with low infectivity, so you have surface antigen positive and it is chronic, so IgG anti-HBC will be there and low infectivity, envelope antigen will be absent and antibody to anti-HBV will be there. So, that will indicate low infectivity. Rest all your symptoms might be there, liver enzyme will be elevated, DNA will be present. If you see the case of supercarrier, which we say immunotolerant chronic hepatitis B, okay. So, supercarrier or immunotolerant chronic hepatitis B, your surface antigen will be positive, IgG anti-HBC will be there, envelope antigen will be there, and your symptoms will be absent, liver enzymes will be normal, and DNA will be there. So, that is supercarrier stage because your DNA is still present, okay. Envelope antigen is there. Chronic inactive hepatitis B, which we say simple carrier, in that your surface antigen is there, IgG anti-HBC is there, anti-HBe might or might not be there, no symptoms, liver enzyme normal, DNA will be there, that is your simple carrier. If it is a case of recovery from hepatitis, the person has recovered from hepatitis B infection, so your surface antigen is not going to be there. It's a case of recovery, you will have anti-HBs, okay, antibody to hepatitis B surface antigen will be there, IgG type of anti-HBC will be there, and you will have might or might not have anti-HBe. So, that is a case of recovery. If the person is vaccinated, what you will see? You will see only anti-HBs positive. So, post-vaccination, what you expect to see in marker, that is your anti-HBC will be there. Rest all marker will be negative in vaccination. So, what is pre-core mutant and escape mutant? Pre-core mutants lack hepatitis B envelope antigen and have poor prognosis, whereas escape mutant will have no hepatitis B surface antigen and it's because of treatment, okay. What is pre-core mutant, escape mutant and YMDD mutant? So, the pre-core mutant is defect in pre-core region of C gene, okay, that is called pre-core mutant. Escape mutant when there is a mutation in S gene leading to hepatitis B surface antigen. YMD mutant will have YMDD locus mutation which leads to lamivudine resistant. So, lamivudine resistant you are going to get in YMDD mutant. So, this pre-core mutant will have inability to synthesize hepatitis B envelope antigen and they have tendency to go for chronic hepatitis leading to cirrhosis. So, cirrhosis, chronic hepatitis, that will be a feature of your pre-core mutant. If you see the escape mutant, mutation in S gene, okay, that is seen in infant born to hepatitis B E antigen positive mother or liver transplant patient who has underwent treatment for hepatitis B, or it can be seen in small portions of immunized patients. So, that is your escape mutant. This might be a problem for vaccination and diagnosis, okay, escape mutant. YMDD, we saw the significance that will lead to lamivudine resistance. So, this is the life cycle of hepatitis B virus, okay, which was asked in one of the entrances. The picture was given and it was asked which virus replication is there. So, you have to see few points which is unique about hepatitis B virus, that it has triple C DNA, that is your covalently closed circular DNA, okay, and you have to see for pgRNA. What is that? Pre-genomic RNA, okay, that is your messenger RNA, reverse transcription in P gene and positive strand is incomplete. So, we say it is a partially double-stranded DNA virus. So, you will see when it's DNA virus which is not complete double-stranded, partially double-stranded DNA virus that you will see, and Hepatitis virus is only one non-retrovirus which uses reverse transcription as a part of its replication. That you have to keep in mind when you get the life cycle on hepatitis B virus. So you can see the life cycle here. So how it enters in the nucleus, they have CCC DNA, and it goes to transcription, then translation and formation of pgRNA, that is pregenomic RNA, then which the reverse transcription will happen and leads to DNA formation and further amplification and release of virion will be there. So this is a graph showing the markers, the viral markers when it rises, when it falls. So this is the axis which showing month after exposure, and this is the axis showing titer. So when you check, the green color is your hepatitis B surface antigen, which appears around 1 month, after exposure and can stay around 5.5 months. And this blue one is your hepatitis B envelope antigen, which comes just after or almost near to hepatitis B surface antigen appearance, and it will stay around 4 months. And after that you get a window period over here, okay. Then your anti-HBs comes, okay, around 6 months around your anti-HBs will rise, and anti-HBe rises around 5 months. So that period here is a window period where your antigen has disappeared and your antibody has not appeared. So that window period in hepatitis B you see in 5 to 6 months. So this graph will show you that when which marker rises and when they fall, that you can see through this graph. What is the vaccine we use for hepatitis? So vaccine is recombinant subunit vaccine, which we grow in Saccharomyces in the East. The adult dose is 0, 1, 6 month, and under national immunization schedule, if you see, it is 6, 10, 14 week, and protective titer is 10 milli-international unit per ml. Okay. So if after vaccination the titer has not rise below 10, then those are non-responders. If there is hepatitis B virus infection along with the HIV co-infection, you have to use tenofovir or emtricitabine combination. Okay, so this combination will treat co-infection of hepatitis B and HIV virus. What is the post-exposure prophylaxis for hepatitis B infection? So if person is exposed to needle stick injury or any injury, and you will check for the protective titer of the patient. If he is vaccinated and his protective titer is more than 10 international unit per ml, you don't need to give any further treatment. If the exposed person is vaccinated but protective titer is not satisfactory, is below 10 international unit per ml, you have to give hepatitis B immunoglobulin immediately and single dose of vaccine within 7 days. If the exposed person is not vaccinated, he has not been immunized with hepatitis B vaccine, you will give hepatitis B immunoglobulin immediately, and then you will have full course of vaccine for the person. So here is a case of a person with hepatitis B surface antigen negative, and he is having IgM anti-HBC antibody negative, hepatitis B DNA not detectable, anti-HBC IgG antibody is there, anti-HBs antibody is positive. What is your probable diagnosis? So you can see most of the markers are negative over here. Only he has anti-HBC IgG antibody positive and anti-HBs antibody positive. So what do you think? So as you remember from the table that when these two markers are positive, those are the people which are recovered from previous infection. Okay. So, correct answer over here is recovery from previous infection. Here is a case of hospital worker and he is found to have hepatitis B surface antigen positive. When you did the further investigation, you found that envelope antigen is also positive and IgG anti-HBC is positive. So, surface antigen is positive, he is a hospital worker with antigen positive, envelope antigen is positive, which will indicates that there is high infectivity. And he is having IgG anti-HBC. So, IgG will indicates that it is chronic infection. So, he is having a case of chronic hepatitis B infection with high infectivity. So, chronic hepatitis B with high infectivity. Hepatitis C, you don't have vaccine because there is antigenic variations, so you don't have vaccine for this. It leads to cirrhosis of liver. You can detect by HIV tri-dot or PCR can be done. Hepatitis D is always a co-infection with which virus? Hepatitis B. So, whenever you get D, there will be co-infection with hepatitis B and there can be super infection, chronic hepatitis B, super infection by hepatitis D virus. Hepatitis E, visa-fecal mode of transmission, you can diagnose with serum sample and stool sample for detection of IgM antibody.